Welcome everyone. Today we delve into a significant phase in every woman's life, menopause. But what exactly is menopause? Well, it's a natural biological process that marks the cessation of a woman's menstrual cycles and her ability to conceive. It's the grand finale of the reproductive symphony, if you will. This process doesn't happen overnight, it's a gradual transition. It's a bit like a dimmer switch. It doesn't just flick off, but slowly dims over time. This transition is orchestrated by hormonal changes in the body. The main players in this hormonal dance are estrogen and progesterone, which decrease as a woman approaches menopause. The term menopause itself comes from the Greek words menos, meaning month, and pause, meaning cessation. So it's literally the end of monthly cycles. Understanding menopause is crucial as it impacts every woman's life in different ways. Stick around as we unpack this complex yet fascinating topic further. To fully comprehend menopause, one needs to understand the science behind it. So let's dive into the world of hormones, ovulation, and how they all play a part in this significant stage of life. Hormones are the unseen conductors of our body's orchestra, signaling different parts to play their roles. When it comes to menstruation and fertility, the key players are estrogen and progesterone. These hormones are like the yin and yang of the reproductive system. Estrogen stimulates the growth of the uterine lining, preparing for potential pregnancy, while progesterone ensures this lining is maintained if fertilization occurs. Now, every month in a process called ovulation, the ovaries release an egg. If this egg is not fertilized, the levels of estrogen and progesterone decline, leading to the shedding of the uterine lining, which we know as menstruation. As women age, the number of eggs in the ovaries decreases, and the production of estrogen and progesterone begins to fluctuate and ultimately decline. This hormonal shift is what leads to the cessation of ovulation and thus menopause. It's not an overnight change, but rather a gradual process that can take several years, known as perimenopause. During perimenopause, the hormonal imbalances can lead to various symptoms such as hot flashes, mood swings, and changes in menstrual patterns. Eventually, a point is reached where the ovaries no longer release eggs, and menstruation stops entirely. This is the stage we refer to as menopause. But it's important to remember that menopause is not just about the end of a woman's fertile years. The decline in estrogen and progesterone also has other effects on the body, such as an increased risk of osteoporosis and heart disease. So menopause is not merely an end to menstruation, but a complex hormonal process. It's a natural part of aging, and understanding the science behind it can help us navigate this journey with knowledge, grace, and patience. How can one identify the onset of menopause? There are several signs and symptoms to look out for. Firstly, there are hot flashes, a sudden feeling of warmth that spreads over the upper body, often accompanied by flushing and sweating. These can last a few minutes to several minutes and can be mild or quite intense. It's as if someone turned up the thermostat and forgot to turn it back down. Then there are night sweats, which are essentially hot flashes that occur at night. They can be so intense that they disrupt sleep, leaving the person feeling exhausted and irritable the next day. It's like having a personal summer in the middle of the night, regardless of the season. Mood changes are another sign of menopause. These can range from feeling slightly more irritable than usual to experiencing significant mood swings, anxiety, or depression. It's as if you're on an emotional roller coaster and you're not quite sure when the next drop or twist is coming. Sleep disturbances are also common during menopause. These can be due to night sweats, or they can occur independently. Women may find it harder to fall asleep, or they may wake up more often during the night. It's like trying to sleep on a rocky boat, never quite finding that calm water. And finally, one of the most noticeable signs of menopause is a change in menstrual cycles. Periods may become irregular, lighter or heavier, and eventually they stop altogether. It's like your body is slowly winding down a process it's been running for decades. But remember, these are just some of the common symptoms. Menopause can also bring about a host of other changes, such as changes in libido, weight gain, and thinning hair. It's important to listen to your body and seek medical advice if you're unsure. Remember, every woman's experience with menopause is unique, and these symptoms can vary widely. Now that we know what menopause is and its symptoms, you might wonder, at what age does menopause typically occur? Well, menopause usually happens between the ages of 45 and 55. However, this is by no means a hard and fast rule. Some women may begin menopause earlier, around their 40s or even late 30s. This is often referred to as premature or early menopause. There are various factors that can influence the timing of menopause. These include genetics, so if your mother had early menopause, you might too. Lifestyle choices and certain medical treatments. For instance, chemotherapy and radiation therapy can induce early menopause. It's also worth noting that the process leading up to menopause, known as perimenopause, can start several years before menopause itself. This is when you might start noticing some of the symptoms we discussed earlier. While the age range is broad, it's important to remember that menopause is a personal journey and can happen at different times for different women. Menopause, though natural, can be a challenging phase, but fear not, there are numerous ways to manage its symptoms. Let's begin by discussing lifestyle modifications. Incorporating a balanced diet, regular exercise, and adequate sleep into your routine can significantly alleviate some of the discomforts associated with menopause. Consuming foods rich in calcium and vitamin D, for instance, can help maintain bone health, which often declines during menopause. Regular aerobic exercises like walking, swimming, or cycling can help manage weight and improve mood. Sleep, often disrupted during menopause, is crucial for overall well-being. Establishing a regular sleep schedule and creating a calming pre-sleep routine can help combat insomnia. It's also essential to limit the intake of caffeine and alcohol, as they can exacerbate menopausal symptoms. There's also the option of hormone replacement therapy, or HRT. This involves taking medications containing female hormones to replace the ones the body no longer makes after menopause. HRT can be highly effective in treating symptoms like hot flashes and night sweats. However, it's not for everyone and does come with its own set of risks and potential side effects, so it's vital to discuss this option thoroughly with your healthcare provider. Other treatments available include non-hormonal medications, alternative therapies such as acupuncture, and over-the-counter supplements. However, the effectiveness of these treatments varies from person to person, and some can interact with other medications, so it's crucial to consult with a healthcare professional before starting any new treatment. Regular medical checkups are of utmost importance during menopause. These checkups can help detect any potential health issues early on and allow for timely intervention. They also provide an opportunity to discuss any concerns or symptoms you're experiencing with your healthcare provider. Remember, there's no one-size-fits-all solution for menopause. It's about finding what works best for you. Whether it's lifestyle changes, hormone therapy, or a combination of different treatments, the goal is to manage symptoms effectively and maintain a high quality of life during and beyond menopause. Menopause is a natural part of life, and with the right knowledge and resources, it can be navigated smoothly. In the journey we've taken together today, we've explored the science behind menopause, the signs and symptoms when it typically occurs, and how to cope with it. Remember, each woman's experience with menopause is unique. It's not a one-size-fits-all situation, and it's perfectly normal to have questions or concerns. Let's take a quick trip down memory lane. We started off by introducing what menopause is, a natural biological process marking the end of menstruation and fertility in women. We then delved into the science behind it, explaining how the decrease in reproductive hormones like estrogen and progesterone brings about this change. Next, we discussed the signs and symptoms of menopause. These can range from hot flashes and night sweats to mood changes, sleep disturbances, and even changes in hair and skin. We stressed the importance of recognizing these signs early on, as it allows for better management and treatment. Then we tackled when menopause typically occurs. Most women experience it between the ages of 45 and 55, but it can happen earlier or later. Finally, we looked at ways to cope with menopause. From hormone replacement therapy and lifestyle changes to natural remedies and support groups, there's a wealth of resources available. But remember, what works best will depend on your personal circumstances and health status. And that brings us to an important point: the necessity of consulting healthcare professionals for personalized advice. Your doctor or a menopause specialist can provide you with the most accurate information tailored to your needs. They can help you navigate this transition with grace and confidence. Remember, menopause is a natural part of life, not a disease or a condition to be feared. With the right attitude and the right resources, it can be a period of growth and self-discovery. Thank you for joining this enlightening journey into understanding menopause. Please subscribe for more insightful videos. Until next time, take care.